Thank you so much, Michelle. It's such a pleasure to be here. And thank you to everyone who is taking their time this evening to join me and talking about two of my favorite subjects. First being cats in general, and second being senior cats. So I know in our practices, we all see a lot of senior cats when we are seeing the feline species. And then with more and more care, I think a lot of cats are aging longer, they're around longer. So this is a really good topic for us to go investigate. And I'd like to point out that I have my trusty sidekick here today, Mama Sita, otherwise known as Sita, and she is one of our home senior cats here. And you'll actually see her in some of the presentation. I'd like to take a moment to thank Assisi Animal Health for sponsoring this webinar. It's been great working with Assisi over the last couple of years. I really enjoy the fact that they really want to promote better health for cats and just better awareness for all of us on how to make cats feel better in their day-to-day life. So thank you. So our learning objectives for today are going to just be to start by defining aging. So, what does that actually mean? We often have people asking us, how old is my cat, doc? So we're going to talk about that. And then we're going to look at well-being as a principle. We're going to talk about physical well-being, but also cognitive and emotional well-being, which is something that we're starting to turn our attention to more and more in our patients. We're going to talk about pain and its impact on well-being, and also throughout the presentation, I'm going to be looking at some aspects of treatment, although we are going to be covering more about pain treatment next Tuesday in our webinar when we talk about degenerative joint disease. I also really want to talk about empowering the caregiver, because they live day to day with these aging cats that they've probably had since they were little kittens. And so it's a big journey for them, and we can help them along with that. And of course, we're going to talk about quality of life. So we really want to set that stage for optimal feline aging. We want to help the owner to understand what the cat may experience, what changes happen in their bodies, and suggest modifications at home that ease the cat's transition towards the end of life. So I'd like to start by pointing out to you that we have some really great guidelines available through the American Association of Feline Practitioners, and you do not have to be a member to access the guidelines. So if you go to catvets.com and under education or the guidelines, you'll find that you can see all of the guidelines that we've published over the years. And the 2021 AAFP Feline Senior Care Guidelines are pretty new. They were just coming out earlier last year, so I think mid-June or July it was. And I was lucky enough to be an author with some very spectacular people. So have a look at these, because they're a very good practical resource to have in your clinic. Even if you don't read it cover to cover, the guidelines offer a lot of really good practical tips and places to look when you're dealing with senior cats. The other place I would recommend that you look is, again, at catvets.com to the AAFP position statement. It's a one-pager on general principles of feline well-being. And I'm going to use this particular position statement to kind of outline some of our pathway today. So we're going to talk again, like I said, about physical, emotional, and cognitive well-being and what that means for our senior cats. So let's start by defining aging. Now, we have a bunch of different ways to do this, and I think when we have life stages and categories, it really helps our caregivers, right? They want to know, like I said earlier, how old is my dog and my cat in human years, and they like to have some kind of an idea. But we do want to try to put them in some categories for them, and that just helps us to initiate those discussions. So if they're asking us, or if we're seeing them for their preventive care and they're 7 years of age, we're going to start talking to them about the fact that their cat is falling into that mature adult category. And then when they're over 10, they're looking more into the senior category. We know that each group has unique preventive care needs, and we therefore want to address each of those preventive care needs at their visits. And this chart here is actually from the 2021 AHA AAFP Life Stages Guidelines, which you also will be able to find at catvets.com under the guidelines. Again, a really good article that subdivides all these different life stages with some basic information that you like. It's a really good go-to for what to talk to people about at each of these stages. If we're using these type of guidelines and the life stage categories, we actually are making our clients more aware of changes or signs as they appear. So we're giving them that heads up, hey, the cat's 7 now, here's the things you need to look for. And that helps us facilitate early detection. Like, I've lost track of how often I've had people who I've taught about muscle wasting, and we're going to talk about that this evening, contact the clinic and say, I need to book an appointment because my cat's muscle wasting. And they never would have thought of that if we hadn't discussed it in a preventive care visit when we were discussing the fact that their cat was mature or senior. Now, when we look at the 2021 AAFP Senior Care Guidelines Task Force, we really wanted to point out that these groups are great, the categories are great, but we also want to make sure that we're looking at those age group categories as patient dependent. So that means that there are going to be some cats that maybe are only 8 years of age that actually exhibit the characteristics or aging characteristics of a senior cat over 10 years of age. And a good example might be a Persian with a really brachycephalic face structure that has really advanced their aging rate. So they may have a lot more signs of an older cat at the age of 8 than a domestic short hair at 10 years of age. So again, it's dependent on their history, their health status, their breed, etc. So looking at that categorization of age groups and the aging domestic cat, and again, this is from the senior guidelines, we're looking at that mature stage as 7 to 10 years of age. Over 10, we're going to start calling them seniors. And these also will include those patients exhibiting changes consistent with changes found in the cats over 10. And then our geriatric, we're going to call more of a statement of health status. It's not necessarily going to be associated with any specific age, but it's going to include patients that are exhibiting sufficient changes in their health status that can exceed or surpass those normally observed in senior cats. Now, the International Society of Feline Medicine also has another category, and I think it starts around 14 years of age, which they refer to as the super senior, because a lot of things start to change at 14 as well. So sometimes I like to include that category, and caregivers really like the term super senior, so it really gets them jazzed up about taking even more advanced care of their older cats. So if we look at the well-being principles and we first start talking about physical, we're going to look at it as the balancing act, right? Those negative things like pain, acute and chronic, nausea, breathlessness, and thirst are going to tip that physical health or physical well-being into a low negative side. But if we are making sure that the cat has comfort, good physical health, and fulfillment of their essential needs, then we're going to keep that physical in a more positive aspect in terms of their physical health and well-being. And that means that we need to get them in to see us, right? Because we can't convey these messages and make sure that the cat is physically well unless we're seeing them on a regular basis. Our senior care visits should be special. They should be identified as different than an adult preventive care visit. It gives us the opportunity to interact with the caregiver, and it enhances the relationship that we have with them and with their cat. It gives us the opportunity to assess the patient's behavior, their physical health status, and also get some really good detailed history from that caregiver. When we see them more often, we can trend changes, not just in their physical health and body weight, muscle condition, body condition score, but also their laboratory values, and compare to previous observations, which will tip us off when things are starting to change. We can encourage communication with the caregiver through these visits and arrange our future visits, right? So in my own practice, we would do every 6 months for senior cats, and sometimes more frequent. And this is where we are with the task force recommendations for frequency of visits for cats that are older. So if they're 10 to 15 years old, the task force does recommend that the cats come in twice yearly. I actually started that even earlier at 8 or 9 years of age, because I did find that some of them were experiencing changes already. We may see that we have to do examinations every 4 months for healthy seniors over the age of 15. Stuff really starts to change fast when they're over 15. And then if cats have chronic health issues, they may require more frequent visits, and that depends on the severity and the stability of their illness. We're just going to help my old arthritic cat get down. She's decided she's getting down off the desk. She's not very agile. So my top 5 reasons senior cats need to see the doctor more frequently than every 6 months are, as noted, cats age significantly faster than humans. So if you wait a whole year for that 11-year-old to come back to see you, you're going to miss stuff. They might be severely hyperthyroid by the time you see them at 12 months, for example. We know they're masters at hiding illness. They have not been domesticated as long as dogs, and they are very much a prey species. So they keep everything to themselves, and they don't want to share with us about what's going on. We know again that as they get older, a lot of the common senior diseases are going to start to rear their ugly heads, kidney being a really good example. We have multiple studies that have shown that body weight, body condition score, and muscle condition score changes can predict early disease and death. So if you're monitoring even just these 3 variables, you might actually get a flag, red flag early on that you need to do something, that cat is now sick and something's coming. That's not good. And again, we all know early disease detection often results in more successful disease treatment or management, right? So that thyroid cat, if we catch it early, we're going to be able to manage the disease. But if they come in and the cat's severely muscle wasted, tachycardic, just not in a good space because of the thyroid, then we're going to have a harder time to rehabilitate that cat with thyroid treatment. When we look at the cognitive and emotional well-being of cats, the negative things that will sort of put them in a bad emotional or cognitive place are things like anxiety, fear, boredom. Remember, they're hunters, so they're very thinking animals and busy and need to be kept busy. Frustration, so if there are things that they need to do and can't. So for example, Sita wanted to get up on the desk with me and she needed a little bit of help, but in the old days, she would have been able to do that by herself. So cats can become frustrated, just like humans, if they can't do things that they used to be able to do. And pain would be another one. And I'm just going to crack my door because she needs to leave. And I don't have a litter box, so we don't want to have any accidents. And then we look at things that signal positive cognitive or emotional well-being in the cat. So if they're desire seeking, so they're still seeking out their food, they're still going to do the things they like to do, they still play socially, they might care for young, if there are young cats around, they have coping success. So if something happens that is a bit stressful, they are successful at coping with that change and moving on, so to speak. They seem to have happiness, a good quality of life, and positive learning and training. And I'm going to now shut the door that Sita's left because other cats will come in if I don't. Just give me a sec. I thought she might stay here for the whole lecture, but you'll get to see her again because she's in the lecture. So here we go. So just looking at cognitive and emotional well-being. And when we see these changes happening, we need to make sure that we're looking at them and having a list of things that we want to address to see where the cat's at with their cognitive and emotional well-being. So we need to adjust their resources and their environment. We need to monitor changes in their interactions. So people might say to us, oh, they're just not coming in and hanging out with me as much. Or alternatively, you'll hear people say, oh, they're very needy and they never used to be. So that can be a change where they actually become more interactive. That can be a sign that they're not themselves. They need mental stimulation to keep their minds sharp. Cats can have cognitive dysfunction. Again, they're still hunters and they still need to be thinking creatures all day long if we can when they're awake. And if they have disease, we want to try and treat what's treatable. So one of the things that I like to use, and this is in the senior guidelines, is the 5 pillars of a healthy feline environment. And you probably see this in a lot of my lectures if you've seen any of my other seminars, because it is so important. It's important at the veterinary clinic and it's important in the home that we provide cats with a safe place and that they perceive that they're safe, not just that we know they're in the house and they're safe from predators, yada, yada, yada. We really need to make sure that they feel safe. We need to make sure that they have multiple and separate resources for food, water, toileting, scratching, resting, and sleeping. They need opportunity for play and predatory behavior. They need positive and predictable social interactions with other animals in the house, including humanoids. But a lot of times we have issues with sometimes people don't know how to interact with cats, and that may be unpleasant for the cat and cause anxiety and stress. And lastly, we need respect for the importance of the cat's sense of smell. So no scented cat litters, cut back on the smelly sprays and the diffusers and all the things that will actually irritate their nasal mucosa, but also obtund their ability to smell. And if they can't smell as well, then they can't detect prey, then they will become anxious. So they need to be able to use all of their senses in their environment to ensure that they're safe. So that sense of smell is very important. And we'll just want to make sure I always put this down here. Their essential needs, or this 5 pillars, should not be confused with feline enrichment, which is sort of part and parcel of the 3rd pillar, but not the same thing. So here's Mama Sita and our old guy, Simon. He lived to be 17 and a half. We really want to adjust and help the owner, the caregiver, learn how to adjust the resources in the environment, right? We're going to provide steps and stairs. So Sita has trouble getting up and down, but we had a dog up until February, and we had to have her food up on this counter. So we would provide her with steps to get up and down because she can't jump up there anymore on her own. So we make those resources easy to access. We may want to actually provide night lights at night because cats start to have diminished vision just like old people do. And we want to make sure they have multiple low-walled wide water bowls so that they don't have to poke their head in a deep container that they can't see. And easy access to meals. So in the bottom left, you can see Simon was sitting in front of the fireplace. He didn't often go to his food. I usually brought him his food in the last year of his life, quite simply because he had cognitive dysfunction and half the time wouldn't come. But if I put the food in front of him, he ate it. Litter boxes are very important at all times, even when we're dealing with young cats, but especially with our senior cats. We want to make litter boxes easily accessible throughout the house. So if your old cat, your caregiver has the old cat litter box down in the basement, we need to add one on the main floor and on the upstairs floor, depending on how many floors they have. They need to be easy to get in and out of, right? And we have these low wall litter boxes that are shown in the top picture, but a lot of people will complain about those because the cats often pee over the edge. So my solution has been to buy the clear walled plastic containers from the department store, cut a door, you can make it as wide as you need to. And that allows the cat to walk easily in and out. But if they're a bit arthritic and peeing up, not really squatting properly, then they're not going to pee out on the floor. We need to take care of that litter daily. And we need to have, again, multiple litters, especially in a multi-cat environment and throughout the house. We need to monitor and make sure we have lots of sleeping spaces that are perceived to be safe and are safe. And remember that as they get older, they will have an increased desire for warmth. The cat's preferred ambient temperature is 30 to 38 degrees Celsius. And I know I'm lecturing to our American friends, so I guess, our room temperature is like 21 degrees Celsius. So it's very warm compared to what we would prefer it to be. Don't think we would like that. But as they get older, they prefer more warmth. And so we want to make sure that they have a variety of options for sleeping, and again, in multiple locations. And then again, nearby to their core resources like water and food, so that they don't have to go far. And again, there's Simon in that top left corner in his hot bed that was by the fire, and I just used to serve him his meals there. Scratching surfaces are very important, even for cats that may be declawed, which sadly still a situation for some cats. Now we're moving away from declawing, so we want to have lots of scratching surfaces regardless of the age of the cat, but we want to continue that into their old age. And that may mean that they may not be able to go up on those really tall posts anymore, but they may still scratch the bottom of them. And maybe we can add some extra shelving for them to get up to the higher levels so they have three-dimensional space. But we can also make use of these lower walled cardboard scratchers that the cats can use as they get older. And some of them prefer the flat ones as well. But one of the studies that was done that looked at size, shape, and textures did find that older cats actually do prefer softer surfaces, which is what you would, if you stopped and thought about it for a minute, you probably would say that. So they do prefer things like carpet as opposed to silo rope or cardboard. So keeping that in mind as the cat gets older. And you can maybe hear Sita howling in the background. I don't know what she's doing out there, but this is what our old cats do, right? We want to monitor the cat's changes in interactions. So they will develop new patterns of interaction as they age, and that can be a subtle sign of sickness. And so again, when caregivers are talking to us, we need to really listen about what they say. And again, if they say the cat's needier than they used to be, well, that's really important, right? We really do want to listen to that, and especially if the cat's going off and off by themselves and not interacting the way they used to, or fighting more with some of the other animals in the house. That's also a sign of something's not right. We want to mentally stimulate these guys. So again, just because they're getting old and people say, oh, they're sleeping all the time, they're getting old, but that's probably because they're painful. And if we're working at dealing with their degenerative joint disease pain, they actually are more active, and therefore they do need mental stimulation. So we need to give them feeding puzzles and food toys. We need self-guided play toys. Maybe the cats can play the Friskies app for cats on the iPad. And they may just have interactive play with us as well, which is very beneficial. So I keep certain toys for my cats in the house that I play with them. And when we're done, we put the toy away. So that's our special toys that we play with. And of course, we know there's lots of things that we can do, we can purchase, but also we can encourage our caregivers to do some do-it-yourself, where in the bottom left, you can see someone glued a bunch of toilet paper rolls together and they're putting kibble into there to help the cat with as a puzzle feeder. So treat the treatable. And I specifically put this picture of this cat who had a pigment change in his eye, which changed over like 3 months. So we had him sent for referral to ophthalmology. But when there's something there that's a specific condition that we can treat with specific therapy, we really want to try and encourage that caregiver, especially if it's something that we know we can succeed at treating and keep the cat in a better state of health. We have to be careful not to overwhelm patient or caregiver. So kidney disease is a good example of something where we tend to, there's so many different things that may be required for that cat during their kidney disease, whether it's food or medications. And so that can become very overwhelming. And we have to understand there's going to be times when caregivers elect not to pursue treatment. And we hopefully can at times work them away from those ideas, especially with things like untreated hyperthyroidism, which is probably a horrible way to live. But we have to try and work with them then if they don't want to do that, by working to look at quality of life factors and look at palliation and end of life decisions. And apparently I didn't shut my office door tight because Cassie is back. So let's talk about pain and its impact on the cat's well-being. So the guidelines task force proposed that pain should really be thought of as a disease in and of itself. So when we think about it, it's just a general thing and that we try to deal with it and identify it, but it really is a disease because if it's not treated, it can very quickly become maladaptive. And here you see a picture of Simon. Simon was declawed as a kitten, and he lived with me for the last 2 years of his life. I adopted him from a caregiver who was moving out of the country. And in the last 4 months of his life, he developed maladaptive pain, amputee pain associated with his declaw. The pain was not very controllable and it became maladaptive for him. And maladaptive pain is not protective. It's not a normal way to be painful. Once we have pain from an injury, it's supposed to be treated and resolved and we heal and it's over. But if cats have maladaptive pain, it's not protective. And then it can give rise to a bunch of other pain issues like hyperalgesia, paresthesia, dysesthesia, hyperpathia, and allodynia. And maladaptive pain has absolutely no purpose and serves no benefit to the animal. So we really need to work at identifying pain in our older cats, especially. So again, we talked about changes in normal behavior that can be signs suggestive of pain. So decreased mobility or activity, lethargy, inappetence, decreased or increased grooming can also be a sign of pain. I keep forgetting to put that in that column. Abnormal behavior, so something the cat didn't do before. Inappropriate elimination, so house soiling outside of the box, inappropriate vocalization, just like Celia was doing out in the hallway. Aggression, decreased social interactions, altered facial expression and posture, restlessness and hiding. And then we may see changes in their reaction to touch. And one of the things that's a key flag for me when caregivers are in is if they say to me, oh, I used to brush her all the time and now she doesn't like being brushed over her hips. Like that's a red flag that the cat's got some arthritis pain over their hips. And we may see changes in physiologic parameters, heart rate, respiratory rate, body temperature, but these are more difficult to assess in our physical exam in the veterinary clinic setting, because as we know, cats get stressed when they come to see us. And even if we're practicing cat-friendly medicine, we're still going to potentially see changes in these parameters simply as a result of the cat's anxiety. So feline chronic pain, so chronic pain that's persisted for, more than a month, we're going to be looking at can result from a multitude of health conditions, and it's going to be more common in our older cats. And we mentioned before, as a newly domesticated prey species, pain is often well hidden, and that really makes the diagnosis for us to be challenging. Like if I've got arthritis in my knee, I can go to my doctor and say, my knee hurts, and it makes this noise when I walk, and I think I have arthritis in my knee. But the cat's not going to tell you any of that stuff, right? So, and they're not going to limp and they're not going to do anything that's really obvious that tells us they're in pain. And we know that pain can impact other health-related quality of life indices in cats. Quality of life indicators can be improved if we attack the pain with multimodal therapeutics and environmental management. And I'm going to touch on this a little bit today here, but I am going to be talking about it in a lot more detail when we go over degenerative joint disease on Tuesday. So there's a list of common conditions associated with long-term pain. So again, degenerative joint disease, osteoarthritis, spondylosis, dental disease. We're going to talk briefly about that. Neurologic issues, myofascial and soft tissue pain, dermatologic issues, so chronic issues with the skin, eye issues, visceral, so if they have inflammatory bowel disease, chronic pancreatitis, etc. Constipation is a big red flag for older cats we're going to look into a bit. Cancer of any sort, can cause pain, so not just tumors, but treatment related as well. And then persistent postoperative pain. And we talked about Simon and his onychectomy issues. It didn't rise for 17 years. Like that was really blew my mind that after 17 years of walking normally and not being painful, he suddenly developed issues associated with that amputation. So anything related to postoperative pain. So in cats, degenerative joint disease is mainly the most common forms of DJD in cats are going to be osteoarthritis, which is the one we often refer to, right? We talk to caregivers about arthritis, but we cannot forget spondylosis, which happens as a bridging between the intervertebral, between the vertebrae. So we have intervertebral bridging, and this is believed to contribute to musculoskeletal pain. And that X-ray that you see in the bottom left there is actually Mamacita, and she's had spondylosis for a really long time, and she's been painful for a really long time. And we know that these cats do better with pain management. Degenerative joint disease is extremely common in the feline species. There's a lot of data to show us that 38% of all cats, all ages, have clinical signs of OA. And 90% of cats in one study over the age of 12 had radiographic evidence of OA. So it's a pretty sure bet that when you're seeing an older cat, even at 8 or 9 years of age, you need to be aware that they probably have some DJD pain somewhere in one of their joints or more than one of their joints. And that should impact how you interact with them and how you handle them. So all of these conditions are painful, right? So we want to be aware of that. So for me, when we're talking about senior care, I'm talking about a team, right? Our caregiver is the person who has known this cat for a long time, and they're the ones caring for the cat at home, and they're the ones who need our emotional support as well as all the other things we provide them with as the cat ages. We are the source for providing accurate, informative resources to the caregiver. We can provide tools and teach the skills necessary to identify and adapt to changes at home. And then we're there to provide support ourselves as veterinarians, and then also our team members, our technicians, veterinary assistants, our receptionists. Everybody's there to provide support to that caregiver and understand what they're going through. Some of the resources that we have are fantastic. There's so many really good resources online. Our AFP has a lot of great brochures. And again, if you go to catvets.com under client brochures, you'll see we have a senior cats have special needs brochure for your caregiver. And in the top right, you'll see just a screenshot of the catfriendly.com website, which is AFP's website for caregivers. And that one is very useful for all kinds of information, so not just for people who have senior cats. Lastly, I always include that Lap of Love veterinary hospice and in-home euthanasia website because it really does have a lot of valuable information for people who are living with terminally ill patients. Cats or dogs, as well as older cats or dogs, and who are thinking about palliation and also wanting to try and figure out when's the right time to decide to euthanize. So what are some of the tools and skills that we can provide to our caregivers? They're pretty smart and savvy, right? They're going to go online and learn all this stuff, whether you help them with it or not. But better if we can actually guide them through this by providing them with information on how to do all of these things. And then they can share that information with us. So if we're talking about measuring their body weight, a lot of people will be willing to have scales at home. We can teach them to do body and muscle condition scoring. I'm going to look at these individually. We can help them figure out energy requirements and daily caloric intake and actually be able to know if their cat's eating enough. Water intake is important. We can help them with that. Fecal scoring is going to be very important as older cats become prone to constipation. And again, that urine production is important because we're going to be able to detect that PUPD. Pain recognition and evaluation is something that our caregivers also can do. So starting with body weight, things are a lot more available now, and people can actually buy digital scales and have them at home. I was always surprised at how many of my caregivers were like, oh, I already have a digital scale at home for the cat, or I bought a baby scale. And so they already are weighing the cats at home. So we're going to try to encourage them to record the data, monitor trends, right? And let us know what's happening and whether they're concerned. Because we know, like I said earlier, that weight loss can precede serious disease or death by 2 to 3 years. So trends downward when we weren't expecting it, they're not actually dieting the cat, is a concern. So obesity is common in senior cats, but the highest proportion is actually underweight cats. So we usually see underweight problems, poor body weight, but when they are obese, it obviously is going to decrease their quality and quantity of life. And some obese cats really do seem resistant to weight loss. Now, here's this big, sudden decreases should be observed with suspicion. Those times when you've had the person, the caregiver has had that cat on a diet forever. They've been working and working and working at it, and they haven't changed anything necessarily. And then they finally come in and the cat's lost weight, and they're very excited because the cat has lost weight. But that the diet never worked before, so the cat's probably lost weight because they're sick. Something's going on, right? It really probably has nothing to do with the diet because it never worked before. So treat those situations with suspicion. It's hard for us because we don't want to discourage our caregivers, but their elation in the weight loss is usually ill-founded. Not really directed at the appropriate cause. There is an obesity paradox in older cats and aging cats. Animals that can maintain some body weight better in the face of chronic inflammatory disease, which a lot of aging processes are, actually have improved survival. So I'll often be content if my patients come in and their body condition score is a little bit above normal, not too much. So if we're looking at a body condition score of 1 to 9, then that 5 is normal or ideal. Then if they're at a 5.5, 6, I'm okay with that. So this is the World Small Animal Veterinary Association body condition score chart. And I like to have this one and their muscle condition score chart up on the walls in my clinic in frames. And I also would hand them out to caregivers. And you can get these online just by putting in WSAVA BCS cat or MCS cat, and you'll see these charts come up as a PDF. And they are validated scores. So it's one of the reasons that I like them over a lot of the other scoring systems that are available, because I know these have been validated for body percentage of fat. And so I get my caregivers to look at these with me, and I will often ask them to score their cats. And we talk about where they're scoring them and whether that's appropriate. And this is where it comes in that people start to actually know what they're doing, and they're doing it themselves, and they're calling us and saying, hey, I guess I need to come in because the cat's muscle wasting, right? The muscle condition score is not a number in this case. We're talking about normal muscle mass, mild, moderate, or severe. And again, if you spend the time to show caregivers what this means on their cat's body and how they feel under those fingertips when they're touching them and where it can be bony, they will start to be very cognizant of this. And so they can monitor this at home. For musculoskeletal changes that are occurring, we all have, as we age, the sarcopenia, which is a gradual decline in muscle mass that occurs even in the absence of disease. Cachexia is a pathologic loss of muscle mass that may be more rapid and is more often associated with specific disease. So should older cats be a little bit muscle wasted and sarcopenic? Absolutely, but they shouldn't be as bony and muscle wasted as, say, Joey in this picture here. He used to come in every 6 months, and he went from being really well muscled to what you can actually see. You don't even have to put your hands on this cat, how bony. You can see his hip bones and his shoulder and even his spine. So when we have this happening, we do have a deterioration of the joint components, we get muscle weakness, and of course, decreased muscle strength, which can then lead to frustration and anxiety for the cat. Never mind, they're probably painful too. Nutritional needs can be really difficult to meet in the senior cat, and we want to keep on top of this with the caregiver. Cats are notoriously finicky in their appetites anyways, but if they have underlying dental and oral disease, any systemic disease like kidney disease, changes in sense of smell and taste, which happen with age, changes in digestion, which happen with age, cognitive dysfunction syndrome. Remember, I said Simon wouldn't come for his food, he had to be served. And there was a reason for that. He just forgot that he was hungry. He just wouldn't come to eat. Degenerative joint disease is going to impact their willingness to sit anywhere or walk anywhere to go and get their food, and any kind of pain. And I would just like to say that we should never consider advancing age alone as a barrier to providing optimal dental care. So often I've heard people say, oh, well, I don't want to do a dentistry on a cat because they're older, they're 13, they're 14, they're 15, they're 18. But if they have really severe dental disease and you don't know how long that cat's going to live, right? And they might live another 3 or 4 years, you really need to get their mouth healthy because it's going to help their overall well-being and take the pain away. And it actually may provide them with a longer quality of life, longer quantity and quality of life. So don't let that be a barrier. We can also ask the caregivers to calculate nutritional needs. We can do this for them initially when we weigh the cat, but then we can also have them doing this at home so that they're monitoring intake. So up to 11 years of age, we know that RERs, or the resting energy requirements, decrease with age about 3% per year. But once cats hit 11 years of age, their RERs actually start to increase as much as 10 to 20%. So simple calculation for cats, you can't do this for animals under 2.9 kilograms or over, I think it's 30 or 39. So this is really something I can use in cats. And if you're working with dogs, you need to go to the other formula. But you really just multiply their body weight in kilograms times 30 and add 7. And that's their basic resting energy requirement for in a thermoneutral environment, what they need to keep going, right? To keep all their bodily functions going and to keep warm and not cold. Then we're going to add 10 to 20% depending on the cat situation. Since Mamacita opened the door to my office, the kitten is now wandering around my office, getting into trouble. So if you hear any noise behind me, that's what's going on. So we want our caregivers to be encouraging food intake. So it may be that cats are going to actually eat less as they get older because their stomach volume will decrease, so they'll eat less. They may feel hungrier more quickly. So we probably need to have those caregivers increasing the number of smaller meals to an increased number of smaller meals during the day. We're going to offer fresh, favorite, and familiar foods, and we're going to warm and moisten and feed in a quiet, stress-free environment. I'm just going to close the door. I apologize. We're going to use encouragement if we need to. Some caregivers have time and want to take the time to pet their cat and praise their cat during feeding. And honestly, I remember when I first heard some of my caregivers were doing this, I was a little bit freaked out. But then if they want to do that and that works for them and they have the time, then that's okay, because these older cats sometimes just really need that. We do have some studies showing that senior cats do prefer their canned food warmed a bit. So we definitely want to make sure we're not pulling it out of the fridge and feeding them cold food from the fridge. It can be warmed up with hot water mixed into it, or even, warmed up a bit in the microwave, as long as we stir it and make sure there's no hot spot in the middle. Cats, as they age, have a reduced sensitivity to thirst, and they will have cognitive dysfunction. Again, they're going to forget to drink. They may forget where the water bowl is. So we need to make sure we're providing them with easy access in multiple locations, encouraging them to drink, having that canned food, and even adding water to canned food. And, we have a lot of really nice products like the PBD HydraCare now that help cats to ingest more water. And cats are much more efficient at taking water in when they eat it, so canned food, because when they're out in the wild, they eat a bird or a mouse, that's 80% water. That's their water intake, but they're not very efficient at drinking. So we want to make sure that we're providing them with foods that have moisture as well. And I just in that, this picture on the right, I did a house call and the cat liked to drink out of a glass. Like most old cats are not going to want to drink out of a glass. But that was the cat's feeding station because he liked to drink out of a glass. Fecal scoring is going to be very important. And again, here's some really great information. We can teach the caregiver and put this sheet in their hands, and they can score the feces at home and understand what's going on with their cat. And even better, when they call us or we call them to see how things are going, they can speak the same language as we're speaking. So I call it the language of poop. If they say it's a fecal score of 3 today, then we know that that's a uniform stool, soft but with some shape. So we get a lot more information if we have this guidance. If they're managing constipation in their older cat, this is very important as well. And you can get these PDFs from most of your food companies. I know Hills and Purina both have them. This one's from Royal Canin, as noted. And I think they updated this one in 2021. Remember that when cats have constipation, constipation is a symptom. It's not a disease. Megacolon is a disease, but it's not as common as we like to think it is, and it's not a common problem for constipation-related issues in older cats. The etiology behind constipation is often multifactorial, and again, caregiver awareness is key. And this chart is from the senior guidelines. So there's some possible contributing factors to feline constipation. So they're eating less, they're drinking less, they might get dehydrated, they're going to have dry, hard stool. Remember that the colon's job is to draw water out of the feces to preserve water for the body. Pretty much the food's been totally digested by the time it's getting to the colon, and the colon is really just recuperating some of those losses. And so if the cat is dehydrated, then the colon's going to pull even more water out of the fecal matter, and that's going to become that dry, hard stool. Same applies with kidney disease, right? They have increased water loss. And then down in the left here and the right, sorry, we see DJD or degenerative joint disease, which is our spondylosis, spondylitis, and osteoarthritis. And that may result in the cat avoiding the litter box or posturing to defecate, is uncomfortable, so they don't do it. So they poop less often. Then the colon has more time to take water out of the stool, and they get constipated. So a lot of things going on there that can lead to constipation. Most of our caregivers are pretty cognizant of urinary production in their cats, just because I think we've got a lot of information out there about urinary tract blockage. But it is good to talk to them about scoop size, right? Clump size. So I had the the luck going to the litter box the other day, and the bottom right, one of the older cats who's in IRIS stage 2 kidney disease had a pee, and it was a giant pee. And while I was scooping at the kitten, who's only 12 months old, was kind enough to come and make my job more worthwhile by peeing again in the litter box while I was trying to scoop this giant pee. And so you can actually really see what a normal adult pee is like through the kitten in the top right. In the same scoop, the IRIS stage 2 kidney cat had a giant pee. And so our caregivers should really have an awareness. And sometimes they'll say to you, well, I have multiple cats. How am I supposed to know? Well, I can tell you, I can tell the difference between whose pee that is. I know the kitten has a smaller clump, and the cat with kidney disease has that big clump. And so we can monitor these things at home, and we need to make caregivers aware that those changes happen, and those are places that they can look. So just moving to talking about pain and pain recognition and evaluation. Now, probably a lot of you are aware of the feline grimace scale, and I always like to point out this is for acute pain. But when we're dealing with older cats, we might be talking about acute pain because maybe they've abrogated and hurt themselves when they already have degenerative joint disease. They might have come in for dental surgery. They might have come in for something else. And the feline grimace scale has really provided us with a good way to score how cats are doing and whether they rescue analgesia. So I would certainly encourage you, and I have those 2 little QR codes in the bottom in a bigger set at the end of the lecture, so you can actually go and learn about the feline grimace scale, how to do it, super easy, and also to watch some videos on it. Your technicians can learn this, your vet staff can learn this, your caregiver can do this, because they've actually looked at whether caregivers can actually do this successfully and identify when their cat needs rescue pain, say the day after dental surgery, and they are pretty good at it. And there's an app. So the Feline Grimace Scale, there is a free app where people can actually take a picture of their cat and have the scoring done, go through and find the score, and they can actually also send the picture in to the researchers in Montreal. So it's really helpful. For chronic pain, we have a lot of different ways to assess, like, for example, for degenerative joint disease pain, and I'm going to talk about this a lot more on Tuesday, but a simple checklist that was designed by Inamoto et al. A couple of years ago, really just looks at, does your cat jump up normally? Do they jump down normally? And so on. It's very simple. And if you want people to have some visuals, Zoetis has a really great website that shows these as visuals and little cartoons of cats jumping up and down. So you can do that. and it's very helpful. So for treating pain and pain-related disease, I always have this multimodal pain treatment pie, I call it, because we're going to want to use multimodal analgesics, so our pharmaceuticals, but we also want to make sure that we're covering them with nutrition and nutraceuticals, environmental modification. I'm waiting for the kitten to knock something down. And then we also can use alternative therapies like physiotherapy, Assisi Loop, laser, chiropractic, acupuncture, and some cats may actually need surgical intervention. I'm just going to pull something away before she knocks something down. There we go. Quiet. Great fun. I'm so glad that the older cat let the younger cat into my office. So the other thing about the pie chart, and I'm going to go into a lot more detail in that on Tuesday because we don't have time to talk about the specific areas, is that we really want to avoid polypharmacy. So when you get into the pharmaceutical, we were talking earlier about quality of life. And if we present our caregivers with too many medications and it's already difficult to medicate the cat, and their kitchen counter starts to look like this one, which is mine. This is my cats. I have all these old cats living here and they're all on a lot of medications. This can be super overwhelming and they're just going to give up. So we need to make sure that we're assessing where the caregivers are at with their medicating and really pick the medications that we know are going to do something. Don't pick medications that are not tried and true, that haven't been studied, that haven't had peer-reviewed studies done. If it's all anecdotal evidence and you've got a bunch of medications that you need to or want to give that cat, pick the ones that you know have been studied, because otherwise we're going to harm the cat's quality of life, the caregiver's quality of life, and it's going to be harmful to the caregiver-patient relationship. All right, if you have to start wrestling your cat to get medications in, that's not good. This is a slide from our degenerative joint disease talk for Tuesday, but I threw this in here just to say, like, we have a lot of nutrition available for us to help cats as they age, whether they have specific conditions, whether they have degenerative joint disease. If they need to lose weight, we're going to try to work at that, but we don't want them to lose too much weight and definitely not too fast. We're going to choose their diet that's appropriate for their comorbidities. So if they have kidney disease or thyroid, or they have degenerative joint disease. And we do have some therapeutic additives to some of these diets to help with degenerative joint disease. We can pick nutraceuticals. So things like well-actin, which has omega-3 fatty acids in. We have some studies to show that's benefited dogs with osteoarthritis. But also other products can include glucosamine, chondroitin sulfate, green lip mussel, chondroprotectants, etc. Chondroprotectants can be helpful, and we don't have adequate here anymore in Canada, but I used to use it quite a bit. And it's anecdotally providing benefit to cats with DJD. We don't have studies on this, but a lot of people use it because it can be, it is considered to be beneficial and helpful. And we do have a lot of anecdotal reports that that's the case. The Assisi Loop is also something that we can use as an alternative treatment at home. It's targeted pulsed electromagnetic field that enhances nitric oxide production. And so the mechanism of action for that Assisi is twofold. We're going to have a radio frequency diathermy, so targeted to enhance the binding of calcium to calmodulin, which is in turn going to accelerate the nitric oxide cascade, regulating inflammation and healing, which is often an issue, inflammation with degenerative joint disease, and some of the other aging things that happen to cats. We also have increased release of endorphins and endogenous opioids. They're really easy to use. My cats, older cats, they're having their nap in the afternoon. I just walk over with the Assisi Loop and lay it on them while they're sleeping. The thing will run its own cycle and it's done. So once a day they get their treatments, and they also have a bed with the sleepy pod in the bottom right. You can see that there's actually an Assisi Loop pad underneath that the cat lays on. So if they like to sleep inside of something, you can do it that way too. There's a lot of different reasons that we might choose to use the Assisi Loop that are listed here that the company is exploring as far as benefits. Using my clicker. So just moving to quality of life, and I'd like to spend the last few minutes talking about quality of life. When we were writing the senior guidelines, we asked Dr. Sheila Robertson to do the quality of life section. She said it's so difficult to define quality of life, but she came up with this when she looked through the literature. And it said an individual's satisfaction with its physical and psychological and health, its physical and social environment, and its ability to interact with that environment. Satisfaction is defined as the fulfillment of one's individual needs or a state of positive mood, and health is defined as the state of being free from illness or injury. Our well-being and quality of life for cats are going to be impacted by so many of the things that we've talked about in the scales: pain, mobility impairment, sickness, cognitive decline, chronic disease, anxiety, fear, and frustration. So the things that affect that mental and emotional quality of life, as we noted before earlier in the lecture: anxiety, fear, isolation, loneliness, boredom, frustration, distress. And then physically, we talk about chronic pain, nausea and vomiting, breathlessness and thirst. So all of these things can impact our patients. So if they have conditions that are causing these things to happen, then we need to consider that their quality of life may be diminished. We need to keep in mind that 5 pillars of a feline healthy feline environment are very important for all cats in all places, and especially for senior cats in their home. So we need to keep the conversation going with caregivers about what's going on at home and what we're doing to keep those 5 pillars going. There are a lot of quality of life scales available. I know some veterinarians like to use the 5H2M quality of life scale. The Lap of Love has quality of life scales that are great for us to use, but also really, really good for your caregivers. So again, I would urge you to point them in that direction and explore the site yourself. And then there's also the Cat Health and Wellbeing, or CHEW questionnaire, that's available, again, to help people sort of get a sense of what's going on with their cat. Lastly, we should never forget that our caregiver also has well-being and quality of life. And while we went to school to learn to take care of animals, there's a caregiver attached to that animal, and we're also looking out for them. And they have a budget, and this is a figure that Dr. Robertson designed for the senior guidelines. Their budget's going to not just include financial, but how much time they have to take care of that cat, how much emotional, how they feel emotionally, and how they can handle dealing with the cat and what they need to do. And then there's also going to be the physical. And the example I always use is we sometimes have those elderly lady clients who have a lot of arthritis in their hands, and they might not even be able to pill the cat, right, at all. They might not even be able to put a pill pocket on a pill, or they have very much difficulty doing things like that. So there may be physical limitations to what they can do to help with the cat's care. We're putting all the little toys away because Kitten's on the desk with me now. So what's normal and what's not is a really good place to start for caregivers too. So this is a picture that one of my caregivers sent me that shows this cat when she was a kitten, and then later on as she's an older cat. And so these relationships have been going on for years, right? And they have more meaning now more than ever before. With the pandemic, it's even become more of an important relationship, and they have a deep understanding of their cat's personality, preferences, and normal behaviors. So we need to listen to the caregiver and help them identify when things are changing, what might not be normal. Cats are going to have a lot of different types of end-of-life needs. They might have need pain management. We need to manage, reduce, eliminate their clinical signs if we can, work on their hygiene, and ensure they get good nutrition, that they have good, as best mobility as we can provide them with, that they feel safe and that they are safe, and that their environment is safe and enriched for them. We want them to be engaging socially with family and other pets and be mentally stimulated. And we want them to have dignity and the will to live and stress reduction. And when those things are diminished, then we need to start talking about end-of-life care and seeking a peaceful end to life through euthanasia. So we're providing emotional support for the client and the caregiver before, during, and after all of this, right? It's a big job for us. Our job is not an easy one. We do have a toolkit also with the American Association of Feline Practitioners, an end-of-life educational toolkit, and I would urge you to explore this one as well, because it will help you with the euthanasia process, with decision-making, final arrangements, and just helping caregivers through this. Lastly, as veterinary team members, we must partner with owners to make well-informed, patient-centric decisions. And so there's a lot of back and forth and talking, and people are going to have different perceptions and opinions about things, and we're there to help them work their way through that. So the senior years really can be golden if we're able to work with the caregiver as a team. And if we can build that trusting bond with them, the veterinary team and the caregiver can ensure that major decisions truly represent an understanding of what is best for each individual cat. So those are QR codes. They're a little bit fuzzy, but I did try them with my phone and they did pick them up. So that's just the Feline Grimace scale in case you're interested. And that's my presentation. So I see we have